speaker is really loud.
And 10, 9.
Good afternoon, everyone, and thank you for joining us on this day before Thanksgiving as we give you an update about the COVID-19 pandemic here in Erie County. Today, Erie County reports 225 new cases of COVID-19 and, sadly, 5 additional deaths. I've previously expressed concern about how high our daily case numbers have been, and my concern only grows as the numbers rise. We have seen 2 of the highest days of the entire pandemic just last week. Those numbers were both over 300. Prior to this, our highest day had been 299, which was before Thanksgiving or just after Thanksgiving last year. So I worry about the days following the holiday this year and the get-togethers that will be happening. The Erie County Department of Health is working diligently to provide rapid testing clinics throughout the holiday season. These tests may also be available at some of your pharmacies and by using at-home kits. I encourage everyone to get tested prior to gathering with others, regardless of your vaccination status, especially if you're going to gather with those who are most vulnerable, such as the elderly, children who are not yet vaccinated who cannot get vaccinated, and those who are immune compromised. Having a recent COVID-19 test can help you to have safer celebrations with your family and friends. None of us want to be responsible for passing this deadly virus on to the people that we care about. We all want to ensure that those we love are still here when we gather at this time next year to celebrate and for holidays for years to come. Any COVID-19 death is a premature death, and very sadly, there have been 31 deaths reported since my last COVID briefing 2 weeks ago. I previously had stated that we were averaging 1 death a day, but these past 2 weeks, we have seen numbers that result in over 2 deaths per day here in Erie County. We have lost a total of 587 of our Erie County residents, friends, families, colleagues, neighbors to this pandemic. My heart is heavy as I consider all the families with empty chairs around their tables this holiday season. To reduce the devastation of this virus, we must use all of the resources that we have to slow it down. This means wearing a mask when you're away from your home and with people that you don't live with. Getting vaccinated if it's possible for you to get vaccinated. Getting a booster if you are fully vaccinated. The boosters are now available to anyone 18 and up. And staying at home if you're not feeling well at all until you get tested and know you don't have COVID-19. Additionally, increasing ventilation during your home or wherever you're at during a gathering can be helpful. So if you can't be outside, which sounds like it's going to be rainy tomorrow and you probably won't be able to, open the windows a little bit. Get some airflow going through that room. Turn on a fan. That will help somewhat. It's important to monitor your symptoms after gathering with others and consult with your physician if you have any symptoms of COVID-19. Those who do have COVID-19 and seek treatment early may have more options and better outcomes as their disease progresses. Likewise, vaccinations are an indicator of better outcomes when you have gatherings and if you are infected with the COVID-19 virus. I have information about 25 of the most recently reported COVID-19 deaths. The actual dates of these deaths occurred between November 3rd and November 19th. The ages ranged from 97 to only 46. 15 of those people were unvaccinated. 12 of the deaths were people under 70 years old. And all 12 of those people under 70 were unvaccinated, which means that all of the vaccinated people who did pass away were part of the older, more vulnerable population that we've been trying to protect since the beginning of this pandemic. Again, all lives taken by COVID-19 are lives taken too soon. We must take preventative measures in order to prevent these premature deaths. We are so fortunate in Erie County to have a health department, to have a team of people who've been working every day to try to prevent premature death. This past Monday, just 2 days ago, was Public Health Thank You Day, and I want to extend a heartfelt public thank you to our Erie County Department of Health, to all of the diligent work that's been done there, and the people who are full of compassion and care for this community. Thank you for your hard work and your commitment to Erie County and its residents. Really, you've gone above and beyond over these past 21 or so months, and I myself am grateful, as are so many others in our community. And now I'm going to turn it over to Melissa Lyon, the director of the Erie County Department of Health, for an update from the Health Department. Melissa?
Thank you, County Executive. It's always a pleasure to be with you. You have touched on many of the important issues we've discussed daily at our Erie County Department of Health, state of the COVID-19 in Erie County. These are the things we discuss daily: the number of cases, how we're going to do vaccinations, how we communicate to the public, what is the message that they need to hear. COVID-19 Delta variant is very present in Erie County, and it is continuing to infect hundreds of people daily, as you have reported. As you've mentioned, this is quite concerning as the holidays are upon us, and we will be gathering with family and friends to enjoy meals and to socialize. So it's important that you do your best to minimize the risk of having COVID-19 be the uninvited guest to your party. Keep your gatherings small, or space out the timing of your guests so that you keep your numbers smaller if possible. The more people that are vaccinated and or test negative prior to the party, the safer the gathering is likely to be. As mentioned, increasing the airflow in your home is also beneficial, especially if guests are in close spaces. As I read yesterday's article in the Erie Times News, Go Inside a COVID Unit, it really brought to light the reality that COVID-19 virus is taking people's lives. It's taking people's lives too soon. It's putting an extraordinary burden on the healthcare workforce. COVID is causing severe illness and death in our community. Yes, there are many new treatments for COVID-19 infections, such as monoclonal antibodies and antivirals, and many more are coming to the market. But the illness is still very serious and is very difficult to treat, especially when you become hospitalized. Less than half of the people that are placed on ventilators will survive. This is very serious illness. I'd like for you to consider getting your vaccinations if you have not done so. Everyone 18 and older is eligible, and you're also eligible for boosters. I urge you that vaccinations are the safest way for us to get through this pandemic with less disease and premature death. I hope that we can all celebrate a safe and healthy season. If you've not been tested and you want to gather, I highly encourage you to do that as well. As the county executive has mentioned, there are a number of places throughout the county, as well as over-the-counter tests that can be used. And with that, I'll turn it back to you, County Executive. Thank you.
Thank you, Director Lyon. And before I turn over to the media for questions, I do want to make a comment about the county's mask mandate for schools, as there's been some question and maybe some confusion raised as the state's mandate has moved through the court system. It's important to note that the ruling, which occurred at the state level, was based on procedures which must be followed and to put an order in place by the governor's administration. These procedural rules are not applicable at the county level, and this decision does not impact the mask mandate Erie County has in place. Therefore, at this time, the county's mask mandate for schools does remain in effect. And I'm now going to turn it over to the media for questions. And today we're going to start with the Erie Times News.
County Executive Jim Martin filling in for David Bruce. You're talking about the mask mandate. And we look at these numbers we're seeing right now. Do you think that's just a function of the Delta variant, or are we paying a price for backing away from masks in general?
Well, I would say it's probably both, but the Delta variant is so much more contagious than the original COVID-19 virus that we know that that is playing a big part in this. But also, the caution that we took with masking, with social distancing, has certainly added to that we aren't doing those things anymore. I, for my own self, wear a mask when I'm out with other people. A lot of people are not doing that. And it's really important, I think, that we all think about that because there's so much virus circulating in this community right now that we're going to have even more higher numbers. I saw that in Erie County, New York, the county executive has put a masking order in for all indoor activity. And it's not to say that we won't do that or we will do that, but it just goes to show that this virus is not only here in Erie County, Pennsylvania, but it's in Erie County, New York. It's actually all over the Northeast, raging right now. And all of us should be very cognizant of that as we travel through these holidays. Thanks, Jim.
Thank you.
I'm now going to turn it over to Erie News Now. I'm sorry, I cannot hear.
Melissa, by the way, thanks for your service to Erie County.
Can you speak up a little bit? I'm having trouble hearing you. I'm not sure if it's on.
How about now? Can you hear me better now?
Yes, I can. Thank you. Did you have a question?
Okay, sorry about that. Yes, I do. First off, wanted to say thanks to Melissa for her service to Erie County. Best of luck in your new public health role out of the area.
Thank you
So
kindly.
the question is, what is the status? You're welcome. What is the status of contact tracing in Erie County as the numbers begin to rise each and every day? How many contact tracers do you have currently? I can only imagine they're slammed. But will you be adding more? Will you maybe even be adding more from out of area?
Okay, Melissa, did you hear that question?
Yes, County Executive, I believe I heard an inquiry around our state of contact tracing, how that's going, and if we'd be expanding that. So I appreciate the inquiry. Right now, when you're seeing cases in 200s or more per day, we're not able to actually get through all of those cases. We've prioritized the cases that we try to reach right now, 0 to 18, primarily because they're school-age children and we know that they are in-person learning every day. So we work closely with the schools on the contact tracing. We've also implemented what we call, it's called the Connect and Protect survey. The state health department uses this survey as well. We send it out to a positive individual that we know is a known positive if we have an email address, and we ask them to complete that survey, and it has some additional information on what they should do if they're positive and communicate to their contacts as well. So at this point, when COVID hits this level in a community, you're unable to do comprehensive contact tracing and disease investigating, which is primarily utilized to stop the spread of disease when it can be done thoroughly. So we're not able to do that, and there's many places in the state and the country that are not able to do that. So virus is spreading very quickly. It also requires that individuals are very compliant with the isolations and quarantines, and we've also had less compliance over as the pandemic continues. The importance for completing the survey and getting us as much information as we can is so that we have complete data sets and we can really take a look at what the pandemic looked like in Erie County throughout from the start to finish. So right now we're using a lot of this as data collection methods, trying to put together what the big picture is. As far as expanding, we're going to continue to do the work. It's fundamental public health work. It's very important work that's done. Hoping that we get back to numbers where we can actually be very effective in contact tracing and disease investigating. But that where it's a wait and see at this point. But we'll continue to have what we have. I don't anticipate hiring more. We sit between 12 to 16 disease investigators and contact tracers, just depending on how we manage that staffing. Thank you for allowing me to have that much time to answer that question. Back to you, County Executive.
Thank you. We'll now go to Jet TV. Is anyone with us from Jet? Not hearing anyone. I'm going to go to Joel at Talk Erie. The technicians here at WQLN, I'm not hearing anything coming out of the speakers here in this studio, so I'm not sure if I'm missing something. I- From them, I'm going to go back and see if Jim Martin from the Erie Times News has another question.
I do, and I apologize. I missed part of the first part of the last reporter's question, but I wanted to ask about, I know there are limits in contact tracing right now. Do we have any information, though, about, whether there have been large groups or, have we been able to trace anything back to large gatherings or anything like that?
Turn that over to Director Lyon.
Thanks, Jim. Appreciate the question. And in order to determine if we had spreads from events or gatherings, we'd have to have pretty comprehensive data collection, where people were, what their activities were. And honestly, the amount of data that's missing right now because we're unable to complete those investigations, it's just difficult to determine. I can't even speculate. We are in what's called high transmission, and therefore the number of cases we're seeing on a daily basis indicates that the virus is really circulating in the community and it's not limited to just gatherings. We know that gatherings can spread quicker, but overall I'm unable to determine that by the data that we have available, unfortunately. Thank you. Back to you, County Executive.
That answer your question, Jim?
It did, thank you.
Okay, sure. All right, let's try again and see if we can get Talk Erie on. Joel, are you there? All right, let's see if we can get WJET on TV. Is anyone there from Jet? Okay, we're going to go back to Erie News Now. Do you have another question?
Sure do. Can you hear me all right?
A little garbled, but I can hear you.
Okay, I'll try my best. This is Eva again, and
Well, I think we lost you, Eva. Okay. We're not having a lot of luck with our media today, so Jim, I am going to see if you have another question. We're going to try to reestablish the line, see if that works with some of our other media outlets. Jim Martin, do you have another question? We're trying to reestablish our lines with our media. I am going to talk about a couple other things. Just want to remind everyone there are 2 business grants currently available through the Erie County Redevelopment Authority. They are administering the new small business grant and the shuttered venue grant. So please go to their website. That's the Erie County Redevelopment Authority. This is to help our businesses offset the losses that have occurred to them because of the pandemic. And then a highlight about a star business. We have a lot of businesses who are really trying to do things right. We have a new restaurant called Bar Ronin in the West Erie Plaza, and they just opened their doors last month. They're working to keep our community safe by having all their kitchen staff and their other staff wear masks, and they spread their tables out quite a bit, so there's more distance between you and the next group of people when you go there to eat. I want to thank the staff of Bar Ronin for doing your part to keep people safe. I encourage everyone to support this new local business and all those businesses. There's many of them that are really trying to do the right thing to keep us all safe as we continue to navigate through this pandemic. And I'm going to see if we have reestablished any lines now and if we have any of our media. Okay, Jim Martin, you are our sole media on at this point. Do you have another question?
I'm the last guy standing. Hey, just one other thing. I take the health director's point about contact tracing. I understand that completely. I guess I'll ask if, as an exception, do we have any information from our various nursing homes? Are we aware of any particular problems, outbreaks, changes, anything there?
Melissa, do you want to take that?
Sure, I'll be happy to. So actually, our long-term care facilities are doing quite a phenomenal job overall. They've learned a lot throughout this pandemic on how they can keep their residents safe, as well as vaccines being available and boosters being widely available, partnering with our health systems on how to get boosters and those vaccinated, and also increasing the number of employees and staff that are vaccinated. So overall, the long-term care facilities are doing quite a phenomenal job overall. It looks very different than the original start of the pandemic nearly 20 months ago. So thank you. And when you do contact tracing in the long-term care facilities, they are really the experts in what that looks like in their facilities. We assist them as needed, if needed, but overall, they're doing that comprehensive work. So it's a collaborative effort. Thanks, Jim. Back to you, County Executive.
Melissa, why don't we stay with you for just a minute? I think you might have a little bit of information on the hospitalizations and where that's at, because that's obviously one of our big concerns going forward. And so do you want to speak to that while we're waiting to see if we get some connection with our other media partners?
Sure. I don't mind speaking to some of the hospitalizations. I sit on a call that occurs typically on Mondays with leadership in the region around hospitalizations. Each week they report out the numbers they have on those Mondays. All of those hospitals had reported some of their highest numbers in the 50s and 60s, and they've all opened up additional COVID units or have had to expand on their number of COVID units available. The article that I mentioned that was in the Erie Times News does a really nice job walking through the day in the life of what happens in a COVID unit and the nursing. I think it gives a really good story. Also, the percentages of those that are on ventilators has remained fairly stable across the last few months. But as I had mentioned, if someone is on a ventilator, nearly half of those do not survive. Once you're on a ventilator, it can be very difficult to come off the ventilators, and it's in a stage of disease and illness that's hard to recover from. So this is some of the real reality. Our positivity rate is some of the highest positivity rate we've seen throughout the pandemic. Each hospital reports a different positivity rate because it's based on the tests that they do, but they all sat around the 19 to 22% positivity rate, which indicates that we are testing the right people and getting them the treatments that they need and the appropriate care. But it also demonstrates that we have a lot of COVID Delta virus in the community. This will also result in the testing that's available. The state contracts with an agency called AMI, and AMI offers free testing in the region. Erie County had been slated to have one of those testing sites here. However, Crawford County, Warren County, Venango County have higher positivity rates than Erie County right now. So the AMI testing is focusing on our regional counties that sit near Erie. So there will be some help for those counties. So overall, it's concerning as we're going into the holiday season, knowing that we are going to gather and we are going to socialize, and I encourage that. But at the same time, I would like to encourage you to have some of those conversations around your dinner table of why it's important to be vaccinated, why it's important to get tested, stay home if you're sick, discuss when it's appropriate to wear your masks. I think that's the only way through this pandemic is for us to really come together and heal our social fabric, as I've been very worried about our social fabric. I've been referring to it as possibly tattered and torn. And if anything we can do this holiday season is have some conversations and let's repair our social fabric so we can get back to the life that we all enjoy with less COVID in our community. Thanks, County Executive, back to you.
Thank you. I'm going to see, are any of our media partners with us now?
Hi, Kathy. Can you hear me again? It's Eva.
I can hear you a little bit garbled, but go ahead and ask a question.
I guess garbled there from nothing, right?
We've been doing this for so many months. We've never had this problem before, but it was bound to
I
happen.
know.
You're again sounding a little bit garbled, so if you can just speak slowly and ask the question, I think we can probably get it.
Okay. So I would like some clarification on the rapid test clinics that Erie County is applying, because over the course of the pandemic, it's been really hard to get a rapid test in Erie County at a pharmacy without having to go to Dunkirk or without having to travel to Ohio and talking about a free rapid test without having to buy a test maybe for 30-some bucks in the store. So what is the clarification that you can give, once again, of the rapid test clinics that Erie County will be providing?
Okay, so the question is about our rapid tests. Other states, other places, you can get it much more easily. You can get it for free. Here, it's very difficult. Melissa, would you like to address that about the rapid tests and what we're trying to do here from the health department?
Yeah, absolutely. I don't disagree with the comment that rapid tests have been difficult to secure in the community, and frankly, they've been difficult to secure in other places in the country too. It's not unique to Pennsylvania. And you've all heard me talk about our public health infrastructure and how each state sort of handles it differently. In Pennsylvania, we are a decentralized public health system with only the 10 county municipal health departments established in the state, while in Ohio, they actually have county health departments in every county. So a very different structure and how they put their resources to navigating the pandemic. So rapid tests became available and were distributed, and each state did that differently. What's happening now is the national government, when vaccines became available, in my opinion, we sort of abandoned our testing strategy and we put a lot of focus on our vaccination strategy as opposed to putting efforts into both of those at the same time. So we're running into supply issues again. Things are expiring. Reagent isn't necessarily widely available. We've been trying to secure rapid tests for quite some time because the supply that we have will be expiring. And it's going to cost us some additional money to do that, but we're committed to purchasing some rapid tests. So how this works right now is the rapid tests that we have, we utilize those in our mobile unit, and the mobile unit does travel throughout the county. We're typically available 2 to 3 hours, and those events can be found on the Erie County website, so eriecountypa.gov under our COVID resources, and there's a testing location. We also promote them on our social media and our Facebook. Those are free. They are 15 minutes. We held one just today at the casino. For I think 11 to 2 was the time frame for that. We'll continue to do that as long as resources are available and locations are available and demand is there. I wish that we had more conveniently located resources for that. LECOM has partnered and been doing that with us as well. They are using some of their resources. And then your collection locations at your hospital systems, I believe they're still using PCR, as well as the free testing at the community centers is PCR. So I can say that the county has really put a lot of resources toward testing. I wish that there were a better answer to say that we had more robust resources that could accomplish this, but it's the state of the testing in the nation right now. I'm hoping that there will be more of that as the Biden administration did earmark money for testing. So it's sort of a wait and see what happens next. So Eva, I hope that answers your question, and thank you for letting me have that much time.
Thank you, Director Lyon. And I don't think that our other two partners are on. I don't think we have Jet or Talk Erie today, so I'm just going to ask Jim, do you have any last question?
No, I'm fine. Thank you very much for the information. I appreciate it.
Thank you, Jim. And I'm going to ask Eva, do you have a last question for us?
Yeah, I do have one more question, and thanks for letting me ask it. Can you hear me okay now?
I can. It's better.
Okay. So I guess with Melissa leaving in a few weeks. What's the status of maybe some of the other health department staff members? Are they going to be staying? Are they going to help with transition? And especially with the work that they have done during this pandemic, and they're needed in the health department, what would it be like moving forward as far as you know now?
Okay, I'm going to let Director Lyon talk about the staff, the leadership staff at the County Health Department as she departs after the 3rd of January. Melissa?
Thank you, County Executive. And first and foremost, it has been an absolute pleasure to serve Erie County throughout my nearly 8 years here as the Public Health Director. The pandemic has clearly been the most challenging work we've done as a public health department, but I know that this work will continue, and I know that public health, I am confident that it will be stronger as we come out of this pandemic, commit to the lessons that we've learned to build a more robust and stable infrastructure for not just Erie County, not just the Commonwealth of Pennsylvania, but the greater good of our entire country. And I'm committed to doing this by moving into this unique and rare opportunity to start Delaware County's Public Health Department on the southeastern part of the Commonwealth and demonstrate how important it is to build public health departments that are responsive to 21st century models and the work that needs to be happening into the future, because this is not going to be our last emergent novel virus. I'm sure we'll see another one, and I'm sure it will be sooner than any one of us would like to imagine. So with that, I can't thank this community enough for everything they've been doing and the hard work that they've done. The leadership at the Erie County Department of Health remains strong. The structures and infrastructure are in place. The resources are available based upon how funding became and how we work with the state. So I'm confident that the work will remain the same. Are we tired? Absolutely. Are we exhausted? Absolutely. Have we felt underappreciated at times? Absolutely. You can look across the country and we've lost nearly 500 top leadership in public health at the local and state level. So the talent pool is definitely shrinking. Some of it is just needing to take a break. Some of these individuals will return back to public health. Some may never return back to public health. So I'd say that our public health infrastructure, as far as workforce, is under-resourced right now. And you'll be seeing a lot of reshuffling of public health talent for the next 5 years. That's not unique to Erie County. You're going to see this across the country. The demand is going to be high and the talent pool is going to be limited. So I can assure you the talent that's here in Erie right now, they'll do good work and they will continue to do good work. What happens for each one of those individuals personally and professionally, that's for them to decide. So as of now, I know that the work will be done well. There's a lot of great work, and I thank you for the time, and I hope that answers your question.
Eva, do you have any follow-up on that?
No, thank you. And again, good luck, Melissa.
Well, I will say, I know Melissa's going to be here for press briefing next month, so she's not gone yet, but it has been a true honor to work with her over these past 8 years, and especially during these past 21 or so months as we've dealt with the pandemic. We have been very, very fortunate to have Melissa Lyon at the helm of public health as we've gone through and navigated this very trying and difficult and unique moment in history. So thank you all for being with us today. In closing, I just ask that you do what is right to keep ourselves, to keep our loved ones, and especially those who are most vulnerable safe from the COVID-19 virus. Do what you can. Get vaccinated, wear a mask when you're indoors with others who are not part of your household. And if you're feeling ill, please stay home and get tested. Call your doctor, get treatment as early as you can. You will have much better outcomes. So thank you all. I wish you all a very beautiful and happy Thanksgiving. And I look forward to talking to you again very soon. Thank you.